Good morning and welcome again to our moral resilience during COVID-19. Today, our theme is moral resilience for social service workers during COVID-19. I, Al Boyce, chaplain at the Northern New England Volunteers of America, and Dr. Rita Brock, Senior Vice President and Director of Shay Moral Injury Center at Volunteers of America National, welcome everyone today. We do not know the magnitude of the stress that is located in facilities outside of hospitals. Estimates have it that over half of the COVID-19 deaths have taken place outside of hospitals. In those areas such as long-term care facilities, homeless shelters, nursing homes, mentally disabled housing, transitional and low-income housing. Today, we feel it is a moral imperative that we address this issue. So we are thrilled for all the panelists from across the country who are here to share their life and experience, their stories with us of the frontline work. We'd be remiss if we didn't thank all the folks who helped us create these webinars. We do something every 2 weeks, and so it requires a lot of volunteer and help, and we want to say thank you. We want to say thank you to Sam McAllister, Rita's administrative assistant, who we call our tech guru. We want to thank Erica Koch and the publicity team at Northern New England Volunteers of America for their efforts in creating our flyer, and our VOA National Communications team for distribution. So many people work so hard to make these events happen, and we're grateful. We're also thrilled today to have our panelists joining Rita, who will be facilitating. We welcome Carla Stallworth-Rembert, Vice President of Operations at Volunteers America Southeast, located in Mobile, Alabama. Anna Darzins, Care Coordinator Manager at Capitol Park Shelter in Sacramento, California. Jillianne Paladino-Boyd, Supportive Services Coordinator at Volunteers of America, Blue Butterfly Village in North San Pedro, California. Maria Freidman, Director of Behavioral Health, New York City Housing and Homeless Services at Volunteers of America of Greater New York. And Dr. James Black, Psychiatrist at Regents Hospital from St. Paul, Minnesota. All are here to share their experience as Rita guides us through the event, and then Dr. Black will be responding to the panel after. If you notice, you also have an opportunity to express your questions in chat. All you need to do is leave your questions there, and we will address them as the panel goes along and as Dr. Black shares with us. With that, we'll go right into the event for the day. Rita takes it from here. Have at it, Rita.
Thanks, Al. I was muted. We're practicing the etiquette of staying muted unless we're talking, and I just had muted myself. I want to welcome everybody on behalf of Volunteers of America. This is our third webinar, and it's the first time that all of our panelists are VOA employees from all over the country. The four that will speak about the social service work that they're doing are doing so on behalf of their work with Volunteers of America. We happen to be the largest nonprofit builder of affordable housing. So the main work we do is the kind of care we're talking about today. And we actually don't know how much COVID has affected this sector of work. We just know that estimates are that half of all the deaths are from outside of hospitals, but it may be even greater because nursing homes weren't counted originally, and so many people died without ever being tested. So the numbers may be much larger. So I'm going to introduce the panelists in alphabetical order in which they will speak, and then after they speak, I'll introduce our respondent. The first speaker will be Anna Darzins. As Al said, she's a care coordination manager at the Capitol Park Shelter in Sacramento, California. She previously managed the first low barrier shelter in Greater Sacramento, which welcomed chronically homeless individuals with their partners, pets, and possessions. Previously, she ran an innovative street medicine program, bringing primary care and behavioral health to homeless encampments. So, and she's going to speak about those experiences. Maria Freidman from New York City is Director of Behavioral Health for our Volunteers of America affiliate of Greater New York, and she works with housing and homeless services. She provides clinical oversight and clinical supervision to Tier 2 shelters, in addition to overseeing all the New York City housing and homeless services that the Department of Mental Health contracts. In that capacity, she provides clinical oversight, training, and leadership in each of the Department of Mental Health funded programs, as well as the Schwartz, and you'll have to, Maria, you'll have to explain what CSS means. Jillianne Paladino-Boyd is Supportive Service Coordinator at a housing facility called Blue Butterfly Village, which is for families. Jillianne has been working with marginalized populations for over 20 years, recently serving as the VOA Los Angeles homeless veteran population services there. And she oversees service delivery and case management of a Mental Health Service Act permanent supportive housing program in San Pedro, California. Her passion is work with the underserved, coupled with her desire to support families overcoming homelessness, which has led her to today's uncharted path, serving on the front lines of assisting some of LA's most vulnerable populations and providing resources and hope. Carla Stallworth-Rembert is Vice President of Operations for Volunteers of America Southeast. And she's been with Volunteers of America for 30 years, but she started as a baby in college and worked her way up through the care facilities in the Southeast in our affiliate. She's a graduate of the University of South Alabama. She has been employed in first as a college intern in nursing care, and then she's worked her way up through the ranks in that field of work until now she's Vice President for Operations. So I'm going to turn it over now to Anna, who's the first person to speak.
Sorry, I did the same thing. Good morning, everybody. It is a great pleasure to be here with you today and have an opportunity to share our work and how this pandemic has affected us. I'd like to start by giving you an overview of what we do at the shelter. We have many firsts that we are performing here for our region. So, for example, it's the first time we're doing a shelter in a hotel. We formed a therapeutic type model using, of course, trauma-informed care, and really focusing our efforts in being therapeutic. In every rule, every action, every position in the building is aimed at a therapeutic environment and community for people who have been chronically homeless. We have severely mentally ill individuals who have severe mental illness and addiction. We are a wet shelter, so we do have individuals who are under the influence in the building, but they can't use while inside the building. This has been an incredible honor for us because we are really aimed at doing the right thing for people and have done an amazing job at sending really vulnerable people home into housing. Since September, we've sent about 100 people home. So we've done many incredible feats, or accomplished many incredible feats, but this pandemic has been something that we weren't ready for. And so the reason we do what we do is because of our servant leader hearts and our interest in taking care of this population in particular, and are so willing and ready to accept the difficulties and challenges of that work. And this pandemic has really brought us to a position of challenging our own understanding of why we come to work. when we arrive, we have to be ready. We have to be ready with the emotional strength to take the trauma, worry, concerns, addiction, fear, anger, and emotions of all the folks that are inside. And we average about 80 to 100 people. We have just had a great deal. It has been an interesting challenge. You begin with this fear of not knowing what you're afraid of, but you're immensely afraid of everything. And so this high intense fear and adrenaline that doesn't turn off. And you don't know where the line is in terms of feeling as though we have to have some strict structure regarding movements in the shelter and safety and serving the people that we know and love. It's a challenge because we have molded our program to be so just accommodating and to come from a place of trauma-informed care and be accepting. And so, which has been largely why we've been so successful, but it's hard to know how to adjust to more structure and to draw the line. And so we see that we have about 50 staff members. What I do is I coordinate healthcare, mental health, our team helps with documents, getting people ready for housing appointments, moving them in, making sure they have furniture, helping subsidize their rent at times, housing retention, which follows them for 6 months after they leave. And all of these tasks have really become heavy and difficult to do. Luckily, we've been able to count on our leadership and who has been so supportive and given us pretty much everything that we need. There hasn't been anything that we needed that we didn't get. And sometimes that's just a place to cry or feel frustrated or feel like you can't come back. In a way where you can decompress. That's one of the major tactics we've been using is this safe space of emotion for myself, for the staff, for the guests, this safe space of how can we resume some activities with remaining safe. So we've done things like go for walks with our guests outside or going to the store with them. It's been an interesting challenge, but we're definitely trying to adjust to it. But I think the hard part is the emotional toll it's taking on us at home. The emotional toll of being so frightened by going outside or coming to work. And it's funny because we do so much to take care of following procedures for cleanliness and social distancing in the shelter. And we also use masks. But from my front door to my car or my car to the door of the shelter is the most frightening space I experience every day. Or going into a store and bringing home anything, or walking in after work and fearing that I'm going to end up harming one of my family members because of the work I do, because of just this compassion that we want to have for this community. So it's been a very big challenge. Without our enormously caring and loving leadership, we would not be in the position that we are now in being able to continue to function, but it's not easy. It's not easy. And I think that that's one thing that we have to really make room for in this space the most is the opportunity to have like emotions that are uncomfortable for folks that do this kind of work, where we might be upset about something or lose our temper about something or be or just feel hopeless about something at any time. and it doesn't have to be about anything. And through that, safe space is how we've been finding ways to continue to move forward and support and encourage and find another solution for what we've come up against. I'm not sure if that's my time.
Thank you to Anna. I think Maria's next.
Good morning, everybody. In my position, it's also an interesting timing that I've been with Volunteers of America since December of 2016, and under the leadership of Leslie Armstrong, Assistant Vice President of Volunteers of America, Greater New York, I was brought on board to create a program under Strive NYC, which put licensed social workers into our 4 family shelters in New York City, 2 in the Bronx, 1 in Manhattan, and 1 in Brooklyn. So I ran this program until early February, and the program has 14 social workers and a program director, and we've been very successful engaging with families experiencing homelessness in identifying and removing the barriers to permanency placement. So that work was very structured. The way it was conceptualized by funded was detailed by a psychosocial assessment, assessing the children to ensure that they're meeting developmental milestones, collaborating with ACS, connecting people to medical and behavioral health services, and this intensive short-term counseling, assessing for depression, for anxiety, and information and referral. So that was the nature of the work. So I started my new position in early February. So this is more a kind of behavioral health guidance to family shelters and clinical supervision of social workers, providing guidance to SROs. And the job was in the early stages as I transitioned, and then the pandemic hit. The goal was for me to continue going on to the programs, conducting meetings with social services, not just with social workers, but with case managers, trying to troubleshoot challenging situations with, tenants, clients, and conducting trainings on various topics such as trauma-informed care. I was supposed to be all over the city, traveling by public transportation, going to the programs, and just very hands-on, as I have done for, my 25 years as a social worker in New York City, always on the front lines, working in various settings, from hospitals to nursing homes to methadone maintenance. So just all this knowledge. So I was really excited of how I was going to bring this knowledge and all this experience to the new program. And then the pandemic hit and New York is on pause. And my own kind of frustration was not being able to go and just having to reconceptualize my role of how do I deliver clinical guidance. It's easier with the social workers that I have hired, trained, and supervised before, but almost overnight, what they were doing with the families had changed. So that required, and this incredible VOA leadership is something that Anna talked about, that feeling so supported and being able to guide people in kind of reconceptualizing their role, because face-to-face meetings were not possible. A lot more had to be done telephonically. So kind of embracing this telehealth, but doing it overnight and figuring out new ways of engaging with families. Again, it's the credit of social workers that in the shelters and their flexibility in changing the way they approach their work and adopting different tasks, because as Department of Education transitioned to online learning, families that are experiencing homelessness in the shelter, the technology was very difficult to navigate. And that's where social workers kind of had to take on that extra task to make sure that everybody had the iPad, was able to log in, the children were connected to school. And in my supervision with social workers, if anything, it's people that I have supervised on a weekly basis, the relationship has become so much closer, because clinical supervision is that unique mix of, administrative and clinical, and people bring their whole selves to work. And just hearing all that fear and anxiety and potentially being exposed, and all of this was happening in the early days of the pandemic, when people were just really scrambling, and the issues with PPE and how do I manage, and real fear, just so much fear almost overnight. And I come, from Russia, and I grew up in the times of the Chernobyl, having family right around there, but it was different. Here, fear was palpable, and it's just how to process, how to give people tools. So it's not, and me, kind of trying to look up the information and seeing what is out there for dealing with, frontline providers that are providing services to clients during the pandemic, and putting different searches into, academic library and coming up with nothing other than psychiatry of pandemics and psychological first aid, and saying, but there must be something. And then the world of knowledge kind of opened up, and people have made so many incredible resources available, and there was this outpour of webinars and articles and different presentations. So the way I continue to supervise is every week putting a guide of behavioral health resources with different articles, different webinars, sending it out, and just hoping that by giving this extra knowledge is that kind of extra intellectual food to give something to providers in the front lines, and encouraging people to take an hour out of their day and watch a webinar on the topic of their interest, and keeping people focused. And this is where, having studied acceptance and commitment therapy, actually practicing on myself and remaining fully present, and just focusing on here and now, and not tomorrow and not yesterday, and just practicing everything that I've been encouraging people to do, and it actually works. And that, creates resilience, is harnessing your own thought process and bringing yourself back to the present and focusing on the breathing. I think what we have not talked enough about, I think, is, the whole topic of self-care, and how people are going through grief and loss and, post-traumatic stress, working in shelters and working in SROs with, clients, tenants that have been exposed to a lot of trauma and vicarious trauma that under normal circumstances needs to be, processed and addressed. And now on top of that, there is this fear and anxiety. And while we grieve collectively, it's kind of shortening this process and arriving at the acceptance stage. And this is a very lofty goal, because we're going to be in it for a while. So New York eventually will get on pause for a while. Things will get, to the new normal, as we call it now, but the future is very unpredictable. And I think it causes, a lot of stress, people just, that there is so much unknown. And even though New Yorkers are resilient enough to 9/11, and people that live through that, it's still, the coping skills are kind of becoming taxed. And there is only so much intellectual food that, I can give to people. What I've been doing myself, and which I find incredibly rewarding, is that I have been working with clients directly. I have asked my colleagues that are running SROs, if they have a client who is struggling, being connected to medical services, behavioral health services, refer them to me. I take those calls myself, and I will sit there and until we find a provider that the client that feels comfortable with. So it's just working with people one-on-one that I introduced in my own clinical practice. And from clients and SROs, that are leaseholders that are independent, I also feel a lot of fear and anxiety. How do I go to the doctor? How do I get my medication? What is it that I'm going to do? And people that have comorbid medical and behavioral health conditions, I think this is where we as providers need to be particularly mindful, because, being on pause, people are not going for their routine medical appointments. So that has been, a concern of mine, of trying, how do we encourage people to still stick to their routine medical appointments? For families in the shelter, I think we're really, the big goal is to make sure that, children under 2 go for their wellness checks. And just encouraging people to embrace telehealth, which, we all had to do with Zoom. Some clients are refusing virtual visits, but how to give people a sense of hope and saying there are still providers there that we can connect you with, and educating people more. And the big idea, we've been doing wellness checks with clients, but at every residential setting, this wellness check is going to look different. Maybe we've been asking about, possible coronavirus symptoms, but I think we need to integrate, a short assessment for depression. We need to do a PHQ-2. We need to ask about suicidality. We need to ask about how people are coping. Are people, drinking more? What about their eating habits? And these are difficult questions to ask in times, working with clients with economic inequality, they may have the bare minimum to eat. So how can we do diabetes education? But still, those things are really important. So thinking conceptually of how to work and how to supervise, I think there need to be a closer collaboration between social service providers and nurses, where we can seek guidance from our nursing colleagues on how to address, more complex clients that don't have access to health care, and how to really intervene and do it competently and do it with compassion and do it in a caring way. How to create support groups using Zoom, where people can have a safe space. If we can come together and have a group meeting, but creating a space for staff and then also for clients. So when the pause, then when we're on mute, being able to quickly create those forums for people to come together, to debrief, to process, to be fully present. And another important thing is was talking about licensed providers. I think where there is a lot of moral distress is people have to practice outside of the scope of their license. And this is something that people just simply need to do, because all the guidelines for telehealth, they've been relaxed because people need assistance and they need help. But it's kind of pushing social workers just to say this is okay to do. It's unprecedented times, as long as what you're doing is somewhat within the scope. But if you're asked to do extra tasks, asking for flexibility. And people that I supervise often feel that they're not doing enough, that there is not enough to give, that they feel fatigued themselves, they're not fully present. And how to learn to really say to yourself, I helped this one person, I connected them to services, I was fully present, I gave them my undivided attention. And that's, saying that's good enough. Maybe on a regular day before the pandemic, you can see 10 patients and do this exceptional quality work. But now it's simply not possible. So how to scale goals, but how to feel fully present with people that we come in contact with. So in thinking of what the social work will look like, and particularly, hiring new social workers, and that's something I have always done as an educator, trying to groom new hires to this new world, because what they were learning in social work school just a few months ago kind of no longer applies. And how we invite people into our setting and saying that, everybody is in their office, we conduct, meetings with clients on the phone, face coverings, no facial expressions. It's kind of relearning and reteaching people and introducing them into this new culture. And I feel this is going to be a challenge, and maybe something that schools of social work, can assist and guide us of how to adapt new providers to this new environment. So it's just more in terms of the future, not what it will look like. And having hope that, this new normal, that we're resilient, we'll learn how to deal with it. We'll provide exceptional services to our clients in the residential programs. Because again, Volunteers of America, and even like this panel, even talking about, moral resilience, moral injury, just fatigue, giving these people extra support, and maybe like a framework of where to put those feelings. Because until, there was no place to park them other than, just people, going back home, that fear that what Anna talked about, going to the supermarket, wearing, a respirator, thinking that I touch anything on my way and that somebody touched me, running away from my neighbors. And like, I live in a building where there are a lot of older adults and people are very supportive. It's a sense of community. So it feels, very awkward to just be running away from people, particularly for, a social work, instead of asking, how are you? How can I assist? Can I carry your bag? Can I help you? So that's really, where I am. But I have to say that Volunteers of America staff in New York, people that I supervise, my colleagues, people are so incredibly professional, and the standard is so high, and I don't see that standard in any way being compromised. If anything, people are doing more, they're working harder, they're coming closer together, and those ties that are being developed now, I think these are sustainable ties, and I think will work better, when New York is unpaused, and we'll be able to move forward as a group as a close-knit group of providers.
Thank you. Thank you very much. I think Jillian is next.
Good day, everyone. It's really an honor to be participating. And it's also quite a privilege to be able to work during this time of global crisis. I don't know for myself that staying home would have been at all bearable for me. I work at Blue Butterfly Village, which we have a really unique population. Originally, it was targeted for female veterans who were homeless and had experienced military sexual trauma. So I have, and then eventually we have mixed groups. We have men and women, and then Department of Mental Health clients, all on one site, living independently. But that history of individuals comes with a certain distrust that we have worked through over the years, and I just feel so grateful that I had the rapport with the clients prior to this outbreak and the early part where it was almost panicking. I was working with some clients who were saying, well, why should I pay my rent? This is end of times. I'm going to need this money to flee. And I was like, well, just in case it's not end of times and you're going to want to keep your housing, if you have your income, let's pay your rent and keep on track as far as housing retention. So what my day looked like in the early part of the outbreak was every moment I had new information. And so when clients would ask me what's going on, I didn't feel comfortable because I didn't have answers. And that was difficult for me in my role. And so I would just refer them to look at the CDC. My team and management at VOA LA was on top of things, coming up with protocols, and we were just, rolling them out as this was happening. I work with a group of people that are already low income and had experienced food insecurity prior to any of this. And with that being said, we usually had a food bank and these types of things. All those resources had dried out. So in addition to what they were dealing with, fear, concern, isolation, the kids being home from school, a lot of the children in the homes were used to having breakfast and lunch at school. So for the family to have to provide all 3 meals suddenly without that in the budget became a crisis pretty quickly here. I felt really blessed when I got a food resource and was able to pick up, for one of the programs, was able to pick up food every morning. And that's kind of my routine. I go to a location, pick up boxes of food in my car, drive to work, and then distribute it throughout the day. I practicing social distancing and safety protocols the whole time. So it has been quite challenging. And I remember speaking with my supervisor saying that in the quiet times is when I'm feeling things and I'm not okay. And that was a risk, but I'm very transparent and I felt I needed to share where I was at with this whole thing and being resilient and so blessed to have skills. None of the normal things I was doing were soothing myself. And I am one that believes I need to practice what I teach. And so I was in there kind of judging myself, like, why isn't this working? Why aren't I, able to focus? What's wrong with me? And then I just had to embrace that it's okay to not be okay. And that's just all right now. My supervisor was like, well, do you need to take a leave? And I said, oh no, not working would be far worse because my struggle is feeling like I cannot do enough. Like I don't have enough resources. I don't have answers. Having people call me, we're doing Zoom counseling now. I do family counseling for the children and the adults, and that has been an all-time high. I have teenagers who were really resistant to therapy calling saying, can I get a session? And I just can't talk. I need someone else outside my house to talk to. So I'm honored to be able to do that. And like I said, a lot of it I think is because I have rapport with the people here. One of the things that came up when I was distributing food, one of the veterans comes to me and goes, oh, are those the COVID treats? I was like, excuse me? And he says, oh, I know the government has you trying to pass out this stuff to poison us. And I was like, you don't have to accept the food. I've got to keep on my route. And just dealing with other people's extreme reactions, emotions, and trying to continue working and managing my own. I had this idea about being galvanized and sort of like a Teflon coating, and I realized none of that stuff is working, and that it's okay to let it in, feel it, be present in the moment, and then let it out, rather than trying to stay busy and not feel it. Because early on, I felt a sense of panic. And similar to Anna, I didn't want to bring it to someone else. I felt like with my work and my level of exposure that I would, if anything, be the one carrying it. I'm pretty sure I would recover. But just in a working day, having these thoughts was quite distracting. So I was like, all right, you can have 5 minutes out of every hour to obsess on it and really freak yourself out. And then you have to stop and go back to functioning. So while that is a skill, I just had to come up with the idea that it's okay not to be 100% okay right now, and to just do everything I can do, and know that for some people, yeah, maybe they do think I'm trying to poison them with government issued food, and that for some people, their conspiracy theories are real to them. And for me to respect that and continue doing the work and not taking that personal or having to, try to justify my actions in passing out food, which was from a government food bank, because the passing out of food is the one time when I actually get to see human faces that I'm working with. I knock on the door and put the package down and step back and make sure they pick it up. And we talk from 6 feet away at the door. And to me, that is really rewarding because I have something tangible to offer the family. The children are at the door, kind of, everybody's at the door pushing their faces saying hello. And that really makes my day. I don't have answers, but my heart is open and I can empathically listen to others. And right now that's my best.
Thank you. Thank you very much. Carla.
Hi. So I'm Carla Stallworth-Rembert. I am Vice President of Operations at Volunteers of America Southeast. As Dr. Brock said, I've been here for 29 years. I've pretty much seen it all. However, these are definitely some of the most challenging times in my tenure here at VOA. Basically, the programs that I oversee are mostly residential sites for people with developmental disabilities. We have over 200 sites, residential sites throughout the state of Alabama. We have a transitional housing 38 unit for veterans who are homeless. We have supported employment, semi-independent living, rehabilitation programs, and as you guys know, all of these programs are services in which change does not work well for a lot of the individuals that are in those programs. So we're providing services to nearly 600 people daily. Those are services and supports that we definitely could not just put on pause due to the pandemic that was going on. So we had to find ways in which to alter, but yet still provide a quality service for those individuals that were in our care. There have been many added variables as far as the results of COVID-19, things that we normally face every day that have been just a challenge to do as a result of what we're in the midst of right now. So some of the social effects that we've been seeing with some of our staff is definitely, probably you can see it with me, sleep disorder and not getting enough of it, muscular tension, increased digestive disorder, irritability, crankiness, depression, burnout. And that's what we're seeing a lot, especially with our employees, because they're working hours on end. We are experiencing a huge staffing shortage. As everyone knows, most of our employees are direct support professionals. Those are the ones that's providing that frontline care in our residential site. There's a national crisis, national shortage for those employees. certainly this pandemic has not made that any better. It has gotten worse. And we understand that because people have a true fear of being able to provide services to others during this time and the risk that's at hand for it. We are all going through uncharted waters, which navigating our way through it as we try to learn best practices for a lot of things that are not even on the radar yet. We're trying to figure things out. I think one of the largest challenges is trying to keep, and I don't want to say morale at a high, but certainly morale not being low. How do you encourage your employees, those ones that are giving 110% every single day? How do you keep those employees encouraged and motivated to come to work? Because they're truly our essential employees. What they do are the ones that's making a difference in people's lives every day. So I think those are some of our largest challenges as far as keeping morale high, as far as having enough staff recruitment and retention of employees. And then certainly supplies. And I heard someone else mention the shortage of supplies. And once you get those supplies in, then how do you make that decision of which site get those supplies? So that's a challenge and added stress as well. As far as coping with the stress, what we've been doing is sending out encouragement to our staff and encouraging people self-care. I think it may have been Anna said that earlier when she was speaking. Self-care is huge. Self-pamper, whatever it is that you need to do to de-stress from working all day and providing care for someone else, because surely we know you can't care for someone else if you're not providing that same care to yourself. So self-care, whether it's whatever form of relaxation, if it's a bubble bath, if it's soft music, if it's prayer, reading the Bible. I'm big on the power of prayer, so I think that's a huge thing. Strong spiritual connections. We're definitely providing education to the supervisory and management level employees to look for signs of burnout in their staff. We're encouraging staff, if you're sick, you're not feeling well, regardless of how shorthanded we are, please, don't come to work, because that in itself can create an even larger issue that we end up dealing with at the end of the day. And then one of the things that we're also trying to do as far as keeping morale up, because I think that's one of the biggest things right now, is letting people know that they are appreciated. And we're doing small gestures. Even our CEO is going out to sites and still maintaining the social distance, but letting people know that just those words of encouragement are saying, hey, I know what you're going through. We appreciate what you're doing. That goes a long way. When we sign on in the morning, we have messages from our ministerial staffs, words of encouragement. We get Monday moments and Tuesday thoughts and emails and videos, and that in itself is huge for us for right now. And what further supports do we need? I think just a shared collaboration of resources out there. How are you educating people? How are you providing that effective communication to people to let them know that these are some very difficult times that we haven't seen, and we may not be doing everything 100% right, but we're trying to learn and provide that education and communication to people as things come forward. So those are some of the things that we're doing, some of the challenges that we're facing every day, and just looking for answers as we go along the way. So
thank you to all of you. Thank you so much for sharing your experiences and knowledge around this. We're going to have a respondent to the panel, and those of you that are attending this webinar, you're welcome to put comments or questions in the chat function as we go along, and we'll be monitoring those. James Black is the person who's going to respond to the panel. He does inpatient psychiatry at Regents Hospital in St. Paul, Minnesota. His research has focused on neuroplasticity, communities plagued by crystal meth, and moral injury among social workers and psychiatric patients. Most recently, he has studied how to ethically ration healthcare as the climate crisis worsens. So I want to invite Jim to give his response to the panel.
Trying to unmute myself. Good morning. I'm very pleased to join the panel and the audience. This is a very important topic to me. Regents Hospital is basically a big city hospital, but we've not seen the surge yet. New York is on the other side of the surge, and we're preparing at this point to switch over to being a COVID positive psychiatry unit. So my colleagues last week, my social work colleagues, my nurses and the other physicians, we were in a regular hospital. This coming week will be COVID positive. This week, it becomes dangerous to go to work. So I'm very concerned about how people respond to the physical stress, the existential stress of facing a life-threatening illness. The other part of it that's important, I'm glad we're doing this topic, the moral injury part of it comes into play with scarce resources. I've been doing research for several years about climate change and about how, considering how expensive that's going to be and how hard it's going to be, that we may end up having to ration other things that we do, coping with disaster after disaster. So I've been thinking about how do we deal with shortages of, not ventilators, but shortages of hospital funds, having to close clinics, having to ration supplies. COVID-19 is a preview, I'd say like an appetizer, a small preview of what we'll be facing over coming decades. So I wasn't expecting COVID, but it turns out this is very relevant for the concerns that I've had. Rita mentioned the work that I've done in moral injury. I've enjoyed helping out this other group that's headed by Wendy Haight, H-A-I-G-H-T, and I would recommend sharing the article with the audience if they ask for it. It's actually one of the studies is of social workers, child protection workers, and their difficult work that they do every day of trying to deal with ethically sketchy or troubling situations. It's not always clear who's at fault and what the right response is going to be. I think child protection, from my experience, is one of the more stressful parts of social work. But as I mentioned, hospital social work has become really stressful now. We've always had difficulty with allocating resources and getting people out of the hospital. I think other parts of social work, working with the homeless, working in criminal justice, also have their own morally ambiguous, spiritually challenging areas. And so I'm glad to have this put together. The focus in the media has been on the existential stress, the challenge of facing an illness and how frightening this is. But I think underneath that or behind it is a moral question of how do we ration resources? How do we cope with these very difficult situations? So, for example, my colleagues are facing life and death coming into work starting this week. But the other part is magnified of what we've always been doing. How do we help people who are homeless? We're not going to be helping everyone. We're not going to be doing the right thing for everyone. We make choices every day to do basically crisis standards of care. That's been in the media too. We don't do the best we can because we have limited resources. That's been magnified by COVID. Now we're having to send people out with even fewer resources. Some of you mentioned food insecurity, for example, or homelessness. Those resources have suddenly become, they were scarce before, but now they've become really scarce and really hard. A number of you mentioned self-care. Little things that used to seem silly to my patients, like I talked to them about diet or exercise or social connection. Now it's become a matter of life and death. This is what we need to do to protect ourselves and to protect our clients or patients. I think some of this is going to become much more stressful in the future. So again, I'm going to sound really gloomy or depressed here, but this is not the worst part of it. I think the disease part, the pandemic, the surge. I think places like New York and some of the big cities are facing the loss of money at this point. The financial catastrophe is coming. So not just the closed businesses, which make us sad that our restaurants are closed, or the lost jobs of our colleagues who were furloughed. The next part is going to be tax revenue. And I would guess that money is going to have to cut, that loss of money is going to have to cut into resources and programs substantially. So this is what I was doing my research on climate change. I'm glad people are thinking about the moral questions of what happens when we cut Medicare, Medicaid in half. What happens when housing programs are lost? And I think all of us here on the panel anyway remember 2007, the great recession. It wasn't called a depression, but that was hard. Programs were closed. I was in Illinois at that time. It was very harsh, and there was no discussion at that point of the moral or ethical implications. It was just done from the top down, closing programs, closing group homes, etc. I'd like to invite everyone to participate in making the decisions now, the ethical decisions now of how are we going to prepare to choose who gets a group home, who doesn't, who gets to talk to a therapist and who doesn't. I think this is a very difficult time going forward, and the moral challenges are going to be really difficult. The last point was kind of the title of this panel discussion, resilience. Moral injury itself is a relatively new topic of research. Rita has talked a little bit about resilience in the past, and they're doing some research, but very little has been done. I don't know the answers of how to help us be stronger, how to help our clients, patients be stronger, but I think it's really important. I hope everyone can think about the future. How do we get stronger from this? Like the idea of post-traumatic growth. How do we get stronger from this moral struggle that we're going through? So thank you.
Thank you. Would any of you on the panel like to respond to some of the questions that Jim has raised, or to each other in any way that you heard something that you wanted to comment upon?
May I comment?
Sure.
We are also receiving text messages and spiritual messages from our leadership, and it's been an amazing. I can't believe I failed to mention it. It's been an amazing help to us, because that's one of the things we found was we felt a little forgotten in the city, because the city was empty except for us. And it was a way of knowing that we were remembered. And so I just want to say that we are also doing something similar, and it's been a really great help. I think that there's this overarching, how do we continue to give care and care for the rest of our teams that also provide care, as well as provide for our families and provide for ourselves. So this is, I think, a very important topic, and so grateful to be here.
Anyone else want to weigh in on that? Jillian. Oh, I thought you were turning yourself on. I think that what Jim just said about this teaching us something important about what the future may look like, because we've already seen, I think, as he's noted, that there's been this massive cyclone on top of COVID that's wiped out whole villages in Bangladesh, and we're going to be entering drought and floods and other kinds of natural disasters on top of COVID. And there's of course, no guarantee that COVID won't come back as well at some point because we've opened too soon. So my question to some of you is how have you coped with the scarcity issue? How have you coped when you know you don't have enough staffing or resources or the things that your clients need? What have been the ways that you have worked through or deal with those on a daily basis?
For us, we've had to prioritize who is whose symptoms or who has a need that must be addressed first. So we've had to, and that's really hard to do, is figure out. No one wants to say this person's issue is more important than another's. So that's been very very difficult. But I think that prioritizing, seeing how many things we can do in small groups with social distancing, finding ways to accommodate, creative ways to accommodate people by possibly offering another resource and becoming really creative in those ways.
Anna mentioned support from the administration. Almost everyone has bosses. And I think it makes an enormous difference in these hard times if you have an expectation that they're going to support you spiritually and, you know, in terms of your time and your family, or if they're going to fire you and let you go. These are very hard times, and it makes a difference when my administration is positive like Anna's is. I don't care if my mortgage company says that they care about me. That doesn't matter, but it does matter when it's your boss. It makes a real difference.
Just wanted to make a comment about resources in general, and that connects to what we've all been talking about, scarcity of resources and lack of availability of providers. And the question comes up, and I think it's a big moral and ethical question. If you have, residents, let's say in housing programs, and that may have tested positive and need to be self-quarantined, and we know they have a psychiatric diagnosis, and they're not adhering to physical distancing, they're not wearing a mask. These are the challenges that have been coming up. How are you to protect the rights of the individual versus the rights of the community? And it's a very delicate balance, because having talked to some of my psychiatrist colleagues, that you can't dial 911 and say, well, I have a person who is not complying with, social distancing. It's just, you have to encourage. And I think that's where the resilience comes in, because you have to be there and you have to kind of triage and, direct traffic and tell, other members of the community that they need to stay 6 feet away, because there is nothing that you can do. This person lives, in your SRO. So these decisions are going to be very hard to do. And this is where I anticipate that tensions may escalate. So it's just looking at what skill set will be needed for providers to learn how to kind of not encourage people to comply with, physical distancing, wearing the mask, reminding, staying focused, and being able to do it for, foreseeable future.
May I also add, it's been an interesting feeling. Our shelter is close to the state capitol, and we see demonstrators coming and walking past without masks with children. And as we're asking all of the guests, please, I know everyone wants to go out. I know everyone feels anxious, right? In this, our friends at the shelter are already anxious group. And so this has added to their anxiety. And then to see others kind of walking by and not even walking by with signs that don't believe COVID is real is really hard to explain why we have to remain firm in our procedures. And I think it's from our relationship, a lot of love, and sometimes they'll say, well, I'd like to do this, but I love you and I can't let you go. I need you to stay here with us. That's, you know, I realize that you're having a really bad day. What can we do? What can we do today? And it's just those kinds of tools.
So we have.
If I could add a note in there for perspective, Texas is already talking about their response to the tax revenue falling off a cliff. They're short on money, and their response already is thinking about cutting on social programs, cutting back social programs. I suspect that's going to be all 50 states pretty soon. So this is a good time to think about, not just like at a personal level of how we deal with people not taking care of themselves, but entire states and communities failing to take care of themselves, making what we would think of as dangerous decisions.
So we have a couple of questions that have come up in the chat. One of them is to the panelists. It says, unfortunately, our administration's view seems to be not totally connected any longer with our staff. The social work staff wanted to put together a support network within our program, but our administration basically said no. We are going through a tough time with multiple changes in staff, but current management seems to be working in their own little group. Our chaplain has been instrumental in providing supportive emails weekly, but no other emotional support for staff is encouraged. How can I continue through this?
That is very unfortunate. And I think that, so I think I'm a little confused. They don't want you to support one another at all, or is it that not during business hours, or I'm confused a little.
So if Ellen could clarify a little bit, I'm going to go to the next question while we get clarification. The next one is, I'm wondering how folks balance the time for grief, lament, and acknowledging loss with the work and many needs that each day brings. One panelist mentioned that so much need and so much work keeps a hypervigilant adrenaline on. How do we move from calming to the last strength of resilience?
I think that one way is to accept that. Sorry, I hear myself. Think that one way is to accept that it's not perfect, and there's no way to address all of those in one day. And so just focusing on the small goals. And so for myself, while I'm not exercising as much, I am eating really well. So I'm not sleeping as much, but I go for more walks. And just choosing some piece of the self-care that you can do, and building off of that is what's been helpful for me.
If I could second Anna's opinion there, these things seem small, exercise or eating right, but they really add up, and it's part of taking care of ourselves so that we can continue to do our work. Usually people respond to me saying that that's not going to really take care of the problem, but it is important. It helps us go back to work and take care of ourselves and show up every day instead of burning out. And something else Anna put in there was being kind to yourself. I hadn't thought of it that way, but maybe I'm a little slack on the exercise, but I'm doing better on the diet. Just be kind.
Look for the good where you can find it. Mm-hmm. The other is that this is something that chaplains, some hospital chaplains have started as a practice called a minute. And I think it can be useful in any context where you are losing people, where you may have a COVID death or another death of a different sort, or you lose it's a way to deal with the losses, which is when it happens to just give everybody involved with it a minute, a little bit of time to take it in, to stop. And especially if you've been trying to save somebody, or you've been working hard, or you've had to help get a body off the premises, or those sorts of things, to just gather everybody that was involved, that's experienced that loss, have them breathe, to calm down the stress hormones that are flooding their bodies at that moment, just for just a pause of silence, so that people can just be in the present moment and take it in rather than run away from it to the next task. And then to say a little ritual blessing or a word of thanks for all the people who tried to save that person, and a blessing over the person who was lost. That is a kind of reset that doesn't mean all of that grief gets bottled up and carried forward. A little bit of it at least gets to be released. And these little moments in the day that seem sort of just slight or trivial, these little, what I would call ritual moments, where everything where it's work related hits a pause button for just a minute or two, that's a little bit of space to restore your soul. And those moments are super important when there is so much stress in the environment. And if you can do it with other people, it's even better. If you have to do it alone because you're self-isolating or whatever, even on a Zoom call, it can be helpful. But it's important to give yourself those little brief pauses in a day to go back to your inner place, to be really present to yourself and to what's in front of you, and not have your head completely full of all the failures and losses and everything that are gonna afflict you. And there's no way to stop them. There's no magic thing that gives you control to stop the deluge of things that are gonna come at you. But you can pause inside yourself and protect a little bit of space. That's your sanity space.
I wanted to respond to Ellen about the EAP and the peer support, the chat comment. I don't want to get anyone in trouble, but this is a crisis, an emergency. So in public health, we're looking at this as crisis standards of care. We don't want to do subpar. We don't want to break the rules. We want to be professional. But in an emergency, we have to bend the rules. In an emergency, we have to do things differently. This is an emergency. COVID-19 is an emergency. I would be less respectful of the administration sitting on you like that, and try and bend the rules a little bit and provide the support that you really do need. This is an emergency, and it might be time to do that surreptitiously, covertly in some way. I think it's important to take care of yourself and your peers. We have to provide that even if the administration squashes that. So I think it might be time to push back and say this is an emergency and things aren't the way they were 3 months ago, 4 months ago.
I want to, this relates to what I just said, so I'm just going to read this. It's not a question, but it's an important comment from Elizabeth. She says, I value the question about coping with this enormous grief, as I also have had many deaths occur in my work. I write down their names in a journal, and I always take a moment to breathe, say a prayer, and light a candle to value the life that has been lost. Self-care alone doesn't validate that loss, but taking a moment is so imperative to give value and lift the grief up to God. So that was her comment. And Al has asked, what are you doing to address worries about your safety from your individual families?
I will admit that in the beginning, I was, you would have thought that I had a compulsive, obsessive compulsive disorder. I was very hyper-focused on cleaning things over and over, and that was not helpful because that is when I was living in a lot of fear. Thankfully, you know, I've been able to work, like switch over to what's more factual and what are we learning in the community. That's been amazing. But things like leaving my shoes outside, taking my clothes off right away, showering before I go anywhere in the house, wearing a mask at home. You know, I have a vulnerable older adult at home who I have to be really careful. And it's been really, really frightening to have to ask myself, how important is this? Am I willing to do something that could end up causing her death? You know, am I willing to go outside and serve others? Why am I not why am I not putting her first? Luckily, my mother is a very faithful woman, and she says not to worry and pray because that's that God's going to take care of us. And so while I just practice all of the procedures I can to keeping myself, whatever I do outside, and changing entirely as soon as I come inside.
Anyone else want to address how you're dealing with the concerns about your own families? Jillian.
Similar to Anna, in the early stages, I washed my hands compulsively until I had raw open wounds on my hands. So I knew pretty early on I needed to get myself some type of skill set that would be protective and not obsessive. I struggle with a little OCD to begin with, so this just sent me into a spiral. So after washing my hands excessively and spraying everything, my husband woke up one night and I was spraying him down in his sleep, and I decided, okay, I need to stop the panic response and really think logically about steps to be taken. And with that, making sure that I have hand sanitizer with me if I'm going from place to place. So not necessarily overzealously and not necessarily effectively doing things, but really practical. I protect myself at work. At home, I do not have anyone in the vulnerable category, but I am very concerned. I have not been able to visit my mother, and that is very challenging for me, or my grandchild. And so I can only do so much to protect the people in my immediate home, because we all live there, and both my husband and daughter are working. So we feel like between the three of us all working, we are all at a higher risk of infecting others. And so we did not attend the Mother's Day celebration, which was an outdoor event. So it's really challenging. I have the neighbor children that run up to me, and I step back. And I'm thinking, I'm not afraid of these children. I'm afraid that I may be carrying something. I haven't gone in yet and washed and changed. So I definitely change my clothes as soon as I get home, wash up, and try to remain distant, but also full of hope and know that I am protected by the universe. And I just kind of forge forward.
Thank you. We have a comment I think it's for Ellen, whose company is not being supportive, which is that your chaplain may have some resources you're not aware of, and chaplains can do things that others can't. So please share your frustration with your chaplain. You may be able to get some help there. And then this is another comment from Elizabeth. I don't think it was said enough, but also it is so important to pause and value the work you are doing. Often our employers or clients don't say thank you, and we judge ourselves on what we should have done or what we weren't managing to do. So appreciate the work we ourselves do and realize that we are doing our very best, and our very best is good enough. It's my tag to that. And then here's a question from Erica. Do you have any advice for social workers working in LTC? We have lost 25 of 74 patients since mid-March. I struggle every day to support my staff's emotions and daily have to find ways to push through my emotions.
I think that it's hard to even prepare yourself to experience a loss like that. And when you are doing the type of work that you do, there's a connection and a love for people that that is the reason you come, or one of the reasons you want to help. And so I think really, while this does not feel like it is a it's not a true like solution, but it could be a beginning of a solution, which is what I encourage you to do for yourself, is find a small ritual that will help you just kind of return to something that you're thankful for, or return to something that you are a positive in the day of what you were able to accomplish, or what you could offer your team. And just because with those small steps, it will kind of begin to build the roadmap or a path that you might be able to find other more meaningful solutions. But you definitely have to start, because I think that that's one of the worries, is if it just piles on and piles on, it could break you in ways that you wouldn't be prepared for, and much more severe.
I wanted to identify something. It's not a coping skill. Part of the reason that's so painful, in addition to the losing 1/3 of your clients, one reason is that these deaths are unnecessary. To lose someone that is in hospice and you are helping them die, you're helping them go through a normal process, that's a good thing as professional. To lose someone when it wasn't necessary, when they're dying alone, circumstances that aren't fair, that becomes a moral problem. And I think that's part of the distress in the nursing homes or some of the other settings we're talking about, the jails. This wasn't necessary. And that's part of the emotional pain that's going to come with it.
Yeah, and it's a kind of moral distress, is it? You feel like it's not right. But it's also, I think, there are instances in which, of course, people have to die alone, because you don't know why. You may not know the cause of death, and it could be contagious. But it's also then that you may be managing so many cases. I heard once a long-term care worker talk about how they were managing, just trying to take care of so many sick people and losing people, that they didn't have time to answer the phones. And they finally had to assign one person every day. They just had to have one person who could answer the phone, because so many families were upset that they couldn't reach anybody, and they were worried about their loved ones. And the person on the phone had to be steeled to do that work, because sometimes the families would be cursing them out and really angry with them, because the families are also feeling the not rightness of the situation, and the only way they know how to deal with it is to take it out on the care facility that's trying to do their best, but they just don't have time to deal with all the normal ways they would be reporting every day, or staying in touch with the families, if it's just not possible. And I think that's another thing that it's important to help people manage, to understand that kind of outrageous anger is not is something that you don't need to take personally, that you can understand why someone might be angry, but it's not a judgment on your work, that you are doing the very best you can do under the circumstances. Because I think it's really important to realize that the distress we feel, the moral distress, the emotional, the sorrow, all of the kinds of experiences that people are having emotionally to what's going on, is a normal response. It has to do with being an empathetic human being and being in circumstances that are profoundly abnormal and wrong, and having to function as an ethical and caring person in those circumstances, that there's actually nothing wrong with you. It's the circumstances. And so I think it's really important to keep reminding yourself of that, or you could start down a deep rabbit hole of, I'm not good enough, I can't do it, this is just too much. There are all of these ways we have scripts about our own inadequacies and our own failures. I just think if you're still doing the work you're doing, it's a good thing, and that and I hope you do find the support you need. I wanted to read a couple of comments. These aren't exactly questions, but I think they are important for everybody to say. It says, I'm so honored, this is from Mary, I'm so honored to hear the words of these brave, strong women. That's the good. Thank you for your honesty and your humility. And then Margarita says, thank you so much for sharing your experiences during these trying times. And then she has a question. What would you advise current MSW students whose internships or experiences are certainly being impacted as much as seasoned practitioners? So what would you say to social work students who are considering going into work as social workers? And I'll let each one of you four say something to those students, because we may have some of them on the call.
Yes, I would like to speak on that. It is such a blessing to have recently gotten staff and interns. I've been working alone for quite a while, so they came in just in the beginning of this. And if I had an intern, I would say this would be the most intense learning experience one could have, and that you're very needed. And for whatever reason, the timing in the planet has the person being an intern during a pandemic. It's all meant to be, and hopefully whoever is supervising your internship can provide you the support and promote resilience.
Carla.
Yeah, I would just like to echo that for sure. There's no better experience than what they can receive right now. So kind of marvel in it, learn what you can, evaluate. And we've had some people that actually stopped and evaluated, is this really what I want to do? And this is the tell all. This will let you know if, I mean, no better experience than what you're getting right now. This will let you know, is this really the field that I want to be in? Because there are some difficult times that's going to come here, yet I don't know any other more rewarding field than social work. So this is a time to evaluate and definitely look at that experience right now with these challenging times.
Maria, you unmuted yourself. Would you like to speak?
Yeah, I just wanted to add that I think it is an incredible experience, and it's just, you know, like medical students graduated early from so many medical schools this year because they were needed on the front lines. So there were no graduations. So you learn on the front lines and you learn in battle. So we don't know about the course of this pandemic. There will be ebbs and flows. There will be opportunities for students in field placement, even though they're coming like into combat right now. There will be opportunities then as, you know, the pandemic maybe just comes in waves to practice social work in a way it has always been practiced, but always kind of being prepared and learning. And I find that having supervised a lot of MSW interns, the students are resilient. If they have, you know, mentors and leaders and colleagues and they feel supported, they're going to adapt. This is going to be the new way to practice social work. And if there is any ambivalence saying like, oh, I just want to be in private practice, I just want to do behavioral health, we'll have to be generalists right now. So this specialization, like think in the discipline of social work no longer applies. It's like all hands on deck. So if the social work intern will be required to cover phones or to cover the front desk in the shelter or to help families, do with the distance learning, it's like any skill set. So I think it's social work schools will have to adjust their curriculum because everything will be taught, human behavior, social environment, but it's going to be taught maybe not in a continuum, but when the opportunity presents itself, but it will make this new generation of social workers better prepared to deal, with the climate change, with future pandemics, and they will come into the world, I think, being a lot better prepared with an incredible skill set.
Thank you. And Anna.
I want to say that this is an amazing opportunity that you'll be able to share your innovation and your creativity and be part of solutions that maybe we wouldn't have dreamt of a year ago. And so I think that there's a lot of an excitement in being part of a solution.
Thank you. There's one more question that I want to speak to. We're almost out of time, but I think it's a really important question because it relates to moral injury, which is something I actually know little about. And the question is, with so much moral outrage, and this is also related to a question about apathy in people, because I think both the apathy and this outrage are related. With so much moral outrage and anger now with limited resources to keep us all safe, looking into the future, it seems like this will intensify so much more. What are ways we can deal with all the anger that arises with the politicizing of this health crisis and the intentional whipping up of distrust towards public health and science? Is there a way to acknowledge this moral outrage inside our professional settings? And I think it's an absolutely crucial question because one of the forms of moral injury that is can be most character changing and destructive is this fury, this moral outrage. And it's grounded in a number of, I think, feelings that come from being betrayed by people who should be doing the right, feeling betrayed by people who should be doing the right thing and are not, and the fact that they're doing the wrong thing is often deliberate, but it's causing intense harm. And we're the people bearing the brunt of that harm, trying to take care of people, and that people literally are dying from the ignorance around the ignoring of scientific information and advice. So there's a huge cost to this to behind the moral outrage, and it's I think it's important to acknowledge that I feel those things as well, and lots of people feel those things, and behind that is often a feeling of helplessness because you can't control what they're doing. They're just doing harmful things, and there's no going back and fixing it. This is the consequence of the behavior, and we're now dealing with the consequences of the behavior. That I think that moral outrage is a really important part of who we are as human beings, that when we see something wrong, it makes us angry, especially when it's deliberately caused or it could be stopped. And I wouldn't say you should not feel those feelings. I think those feelings are legitimate. But if they start to interfere with your capacity to keep working, or you begin to become angry at everything and stop losing your core empathy and compassion, then it's really important to find a way to process that anger so it isn't running your life. And to channel that. So when you aren't being run by anger, but you know that you are angry, then you can make choices about what you do with that anger. And it might be to join a movement. It might be to become somebody who wants to make changes to stop the harm. And those can be really constructive ways to channel that anger. It might be just to write letters. It might be to work harder to in your context to do positive things. to try to so I think it's really important to attend to the anger. It's an important moral voice inside you, and then to find ways to use that anger in positive ways so it doesn't wind up running your life. Because there are some studies of combat veterans that indicate that betrayal, this kind of fury that dominates that moral response to betrayal, can actually lead to aggravate other kinds of trauma like PTSD. There's a high correlation between betrayal and PTSD, having PTSD. And we don't know whether one causes the other or they just happen to occur together, but if you don't attend to your own anger and you stew in it, is the way I would put it, it can really wreck your sense of being in the world in a good way. So use it, use it for good. Anger can be a good thing, especially moral outrage. But anger, when it runs your life, is a kind of moral injury that can take you down a pretty bad road to self-destructive behavior. Jim, yes.
I wanted to add that I think the anger is healthy, but it needs to be channeled in a positive way. I wanted to recommend the writer Rebecca Solnit, who's written about kind of the inherent goodness of people in a catastrophe, in a crisis, about how you can reasonably expect people to do the right thing and work together as a community. It's very discouraging to read the news, or to watch the news these days. But she wrote 2 books that were very influential for me. Hope in the Dark is one of them, and then A Paradise Built in Hell. Solnit, S-O-L-N-I-T. And I could recommend those for people feeling discouraged about politics over the last 4 years. It's good advice, good stuff.
Thank you. And we will be posting the recording of this webinar on our VOA Moral Injury site, and we will list those resources there as well that Jim has mentioned, and any other resources that people share in chat or we get around these topics. But I want to thank everyone, as people have said, for your courage and your honesty and your experience and the willingness to share that with us. And we'll all keep hoping and praying for a better world, or at least some relief from the conditions that we're all working in under right now. So thank you. Al, do you have any final words you want to add?
I just wanted to say a real clear thank you to Anna and Maria and Jillianne and Carla. It's a real privilege to call you colleagues, even though we're all across the country, and your candor and honesty just really touched me, and I know it has helped and touched so many other in the audience as well. And Dr. Jim, thank you for your contribution to the conversation. It's an ongoing, continuing conversation, and certainly we appreciate your time and talent today offered up to help others. And so much appreciation. And just want to put a real quick plug. We expect another one of these events in a couple of weeks, and we're looking at it. The theme will be working as chaplain during the time of COVID-19, and that may adjust, but as of now, that's where we're aiming. And so we hope you'll just kind of get the word out. And otherwise, we appreciate everyone who is supporting our effort, and we're privileged to be doing it together. So with that, we'll close down our webinar for today.